And good morning. My name is Tom McCarthy. I'm the Executive Director of the COVID Unit at the Rhode Island Department of Health, where it's been my honor and pleasure to serve under the leadership of Dr. Alexander Scott. We are very excited to be here today to be making this announcement. No doubt about it, the governor gave us a tall order to get the first dose of vaccine into the arms of every teacher, every school staff member, and all licensed child care workers in Rhode Island by the end of March. This is in line with the national goal voiced by President Biden, and it's in line with the approach that we've been taking in Rhode Island throughout the pandemic. Prioritize learning for our kids. Do whatever it takes to create environments where the most learning possible can take place. It's been an all-out sprint for the last week as the joint team put the plan together, and we're going to be sprinting for the next 3 weeks to get this done. But I feel very confident that we're going to be able to meet the target set for us by Governor McKee. One of the reasons why I feel so confident about this is because of the great partnership we have from people like Mayor Grebian and the city and town leadership throughout the state. If you recall, there are 3 main vaccination venues in Rhode Island. So public-facing, those are retail pharmacies, our large state-run sites, and the 30-plus city and town-run clinics throughout Rhode Island. This is an example of a city-run clinic in St. Anthony's. This is Pawtucket's site. The vaccinating of teachers, school staff, and child care workers will be happening at sites like this throughout Rhode Island. The one exception is in Providence, which Commissioner Infante Green will be sharing some more detail on here in a second. So this is separate from, but in addition to, the vaccinating of teachers that CVS and Walgreens has started over the last week. So we've got a strong start to get us going here. We're estimating that we need enough vaccine to cover roughly 18,500 teachers, school staff members, and child care staff throughout our city and town-run clinics. And we've arrived at this figure because we know roughly 1/3 of teachers have been eligible as part of another cohort over the last month or two here. We've seen about a 70% acceptance rate among eligible groups, and we're continuing to refine that number with our schools, our child care providers, and our cities and towns. When it comes to child care providers, we're including all employees who deliver direct in-person services to children in DHS-licensed child care settings. So this includes custodial staff, security and transportation personnel, as well as therapists and support staff. These figures for schools include people at public, private, parochial, and independent schools. It includes anyone in a school who provides regular, direct service to children. So this means administrators, teachers, paraprofessionals, support staff, clerical staff, custodians, bus drivers, and others that are critical to the daily operations of a school. Many clinics are prepared to start vaccinating teachers and staff as early as this weekend. As I said, we'll be vaccinating throughout March for first doses, and then clinics will continue into April for second doses. As is the case at all of our clinics, there is no cost associated with getting vaccinated, and there is no insurance requirement. School leaders and licensed child care providers will be working directly with municipalities to schedule staff for vaccination at our 30 different city and town sites. Municipal emergency management directors will be reaching out to school leaders, such as district superintendents, charter school leaders, non-public school leaders, as well as DHS licensees for child care centers to begin the coordination. School and child care workers do not need to call their cities and towns. You will be contacted in the coming days about how you can schedule your appointment. People will also be vaccinated based on the community where they work, not necessarily the community where they live. That's because that's where those relationships have been built with the municipalities. I want to wrap up by again thanking and acknowledging the city and town leadership, the emergency management teams throughout the state, and everyone on the ground that is supporting their communities every single day throughout this pandemic. When we sat down as a group to think about how to operationalize the governor's charge, it became very clear very quickly that we needed the cities and towns in order to make this happen. They've emerged as a backbone of the statewide response over the last several months. The most recent example is how they stepped up to vaccinate some of the most vulnerable Rhode Islanders in the states, those that are 75 plus. We're enormously appreciative of their effort and support and are looking forward to an exciting few weeks getting shots in the arms.